just so happy that we can bring attention to a disease that really needs to have a lot of research continued and sustained. And I can bring that message home and also highlight the work of MS nurses in our community, the amazing work that they do, and what we need to do to get more MS nurses on the ground. Even the last 5 or 6 years, we've made huge leaps again in our understanding and in our treatment of MS. So 20 years ago, the way that MS was managed and what I saw in clinic is completely different to what happens now. So to see that transition, both in terms of having so many new drugs coming to market from all of the research that we've done, and a lot of that's been done in Australia over the last 20 years as well, and I've been involved in those clinical trials from the early 2000s, to seeing how people can live so well with MS these days. It's just been incredible, and to have been a part of that, even in a very tiny way, is probably one of the biggest accomplishments that I feel, because I've seen that change in people. And what our our consult with a patient would look like 20 years ago compared to what happens now is just chalk and cheese. So now we can very truthfully say that things will be much better. We've got much better treatments now. You know that you can expect to have a life that is still full of the dreams that you might have had before you were diagnosed with MS. Whereas a long time ago, we didn't necessarily have the knowledge to be able to say that. I worked in HIV and AIDS in the 80s. In the late 80s, early 90s. And from then, I was lucky enough to meet some like-minded neurologists and immunologists at Westmead Hospital, just at a time when MS was getting really interesting and new treatments were going to be coming through. And it was right at the start of MS clinics being created in Australia. And I really wanted to be in on that. The scientists that I was working with at Westmead at the time, and the immunologists and neurologists, were all very passionate about patient care, and they all believed that really good nursing care could make a difference in living with chronic illness. And I think that's what really grabbed me and pulled me in, this chance to make a huge difference in people's lives. I wasn't so sure about MS at the beginning. The first clinic I went to, I was paralysed with fear because I just didn't know enough about it. But I was fortunate to work with some very kind neurologists who were happy to teach me. And it wasn't long before I knew that this is where I was going to spend my life's work, and I wanted to be an MS nurse. So there were no qualifications in Australia at the time, so I had to do an international exam, which was based in the USA, to become an MS certified nurse. And then after I did that, I just fell in love with it, with the patients, with the families, with the type of work that we're able to do, being able to make such a difference on a daily basis for people, just really grabbed me in, and that's when I also started my research path, I think, because I really got tired of saying I don't know, to the barrage of questions that people living with MS, particularly when they're first diagnosed, are faced with. Made so many big leaps forward and so many advances, but we still don't have a cure for MS. And MS is really challenging. It's a hard and complex disease to live with and to manage and treat, for medical professionals as well. As MS happens in the prime of life, most often diagnosed between the late teens and 40, that's a lot of years to be living with a chronic illness. So we don't have all the answers. So we need sustained, consistent research moving forward, supported by funding, particularly for the scientists and for the clinicians, to help get us there and find that cure, and to improve quality of life along the way while we work towards the cure.